In this presentation, we'll be talking about measurement scales. So, before we begin, we need to understand why good measurement is extremely important for evaluation. It provides evaluators with a certain amount of precision in arriving at magnitude of client's problem and determining any consequent change in those problems. It is also important to select instruments that are good indicators of what programs are attempting to achieve, and it is also uh, should be psychometrically strong. It is not always necessary to use paper and pencil instrument to measure program outcomes. However, sometimes it is essential to use paper and pencil instruments. We'll look into those scenarios as we look into this presentation. This is a case study where Jim, a grad student, was asked to evaluate a residential treatment center for youth who had experienced trouble with juvenile justice system. He noticed that several of the most successful residents at the time of release seems to have experienced an increase in self-esteem. One afternoon, while browsing on the internet, he found a self-esteem instrument that looked as if it could be used for program evaluation. After deciding on one group pre-test and post-test design, Jim made a number of photocopies of self-esteem instrument and with the agency's director's permission began administering it to new admissions. 11 months later, he had collected 42 pre and post tests from residents who had been discharged from the treatment center. He was surprised to learn that there was very little difference in pre and post test score. Does this mean that the residential treatment program was unsuccessful? So, sometime we need to understand if those instruments which we are using to evaluate our programs are they appropriate or relevant. In this scenario, some of these questions may arise. As we think about this scenario, the lack of information in several areas should cause you to raise questions. Is increasing residents' self-esteem a clearly articulated goal of the residential treatment center? If it is not, would use of self-esteem inventory to evaluate the whole program be a reasonable measure? Even if it is important goal of the program, how likely it is the youth in the treatment will actually experience an increase in self-esteem? Is there evidence from the literature to suggest that residential treatment centers for this population commonly increase self-esteem? Could any other variable be used to gauge the success of the program? You may have many more questions in this scenario, but these are some of the important questions you may come across. And accordingly, we have to think what is appropriate instrument or questionnaire or survey that will measure the impact of the program and measure the outcomes. These are some of the examples that those are listed in the book. The program success and failure. What are the indicators of success and failure of particular program? If the program is alcohol and drug treatment program, the success must be measurable. It can be days of sobriety when one has not consumed alcohol or drugs. The failure can be measured as days of drinking, public intoxication, or DUIs. Similarly, these are other programs like day treatment for severely ill, mentally ill. So, success can be measured as days of independent living in community and failure can be re-hospitalization and number of days in the hospital. Similarly, for juvenile and adult criminal justice diversion programs, so the days without arrest can be a measure of success, and re-arrest or days in jail can be a measure of failure. For employment and training program, the wages and hour worked can be a measure of success, and the amount of entitlement received can be a measure of failure. Adoption programs, number of permanent placement made, number of children eligible for adoption still in foster care. So sometimes you may get measures for success or failure directly, sometimes it is indirectly. You can find out the symptoms where, like in adoption program, we measure the failure in terms of if there is number of children eligible for adoption still in the foster care. For child protection program, the success can be no further reports or evidence of abuse or neglect, and the failure can be substantiated reports of abuse or neglect. Sometimes we ask, how could program success be demonstrated? What is the program trying to accomplish? That we must know. If it fails, how would that failure be noted? Programs can be evaluated with routinely collected data that can be evaluated in terms of behavioral outcomes without interviewing, observing, or distributing questionnaires to program recipients. What should we measure? So there can be different outcomes related to behavior. So the behavioral data can be included, and that can include specific psychological measurements that can be obtained through use of client self-monitoring or taping clients' interaction. Behavioral outcomes not only always available to evaluators, sometimes prevention programs measure whether program recipients have increased their knowledge of given problems. The main goal may be to change the participants' attitude about some behavior or practice. So there are three aspects here: the attitudes towards behavior, the behavior itself, and also the knowledge about the issue. Often it is easier to measure the attitude or knowledge than the behavior. In those scenarios, it is important to see the connection between the attitudes, knowledge, and behavior, and many a times it is weak connection. What it means is, the if people have knowledge about certain issues they may be facing with. Example, if they know the implication of alcohol consumptions on health. uh, However, their behavior of consumption of alcohol may not have any relation with their knowledge of the health hazards. So there is weak connection between that. So many times the way you collect the data is also important. When people are at their own using paper and pencil, or they have their self-reported behavior, this sensitive information about their behavior can be reported, as opposed to the attitude and knowledge behavior. As we think about this measurement scale, we have to think about reliability and validity. The reliability is very important. Our instrument is reliable when it is consistently and uh, dependably measures concepts with accuracy. We are administrating it to similar groups yield similar results, and it provides a consistent frame of reference. So the eligibility coefficient of 0.70 or higher is considered acceptable in most social science research situations. Similarly, the validity is important. Valid instrument is valid when it is closely correspondent to the concept it was designed to measure. So first is reliable. So every time you measure it, it measures the same thing. So that is again and again it measures the same, gives same results. The validity is about the conceptual design, what you want to measure, it is measuring that particular content. So there are two aspects, one is content validity and another is face validity. The content talks about the established, it is established by asking experts to review if the entire range of concepts represented by sample of its item selected for the scale. So the questions those are listed in the scale are asking the right questions related to the larger uh, uh, question about the behavioral or the knowledge of the respondents. The face validity, when used when colleagues or other knowledgeable persons agree that the instrument appears to. So on just looking at the measurement or the scale, it looks really valid. So there are two aspects, face validity and content validity. Neither the content validity, face validity is sufficient for establishing that scale is truly valid. Developer must amass evidence that the scale really does measure what it has intended. So in another presentation, we'll look at the constructing good instrument for evaluation.